Hi, this is Matt Geha, Superintendent, and I'm here with one of our directors today, Liz Harris, who's the Director of Health Services for Springfield. Liz,
So I worked as an OB nurse at St. B's, and I did that for about 10 years, and then I also worked at St. B's before that on a med-surg floor.
Good. So health services have essentially evolved over the years, but it's not a new concept for any school, but the way we've done it has evolved and improved. So who's part of your health services team here in the district?
So we have 5 nurses that work within the buildings. So we have a full-time nurse in every building. Those nurses are employed through ProMedica, and then myself through the district.
Good. Now you do a few things for us. So I know currently you're also covering a building.
Correct. So I'm in a building full-time during the school day at the middle school, and then I'm still overseeing all of our staff. I have input on all of our health policies. I help run our clothing closet, and then I am the liaison for the district between our school-based health clinic, which is housed in the high school.
Good. So what kind of equipment do you oversee for us PK-12 here in the district when it comes to health services?
So we do of course, our vision and hearing screening, any medical equipment, so children that are in wheelchairs or any other medical equipment they would need, devices to take their medicine, help their mobility.
Good. By law, we have to have certain items under every roof, and you've helped us manage those. Can you share with what you've set up in every school?
Yep, so this, we've now updated all of our emergency equipment. So if we ever have to evacuate the building, every building now has backboards. They have the equipment to take children down the stairs if we have children unable to get themselves down the stairs. We have bags that all of the nurses have with equipment that they can go to a student if there's an emergency.
Good. Share with us the AED program that you help manage as well.
So all of our AEDs, by Ohio law, we have to have an AED in every building. We actually have 20 throughout the district that we manage, and then with our staff now we have medical emergency response teams, and we practice drills every quarter to make sure that they're able to help the nurse and the student or whoever may be in need of help.
Good. So we also have a health clinic separate from the health services department in our district.
Yes.
And you were a big part of having that occur in the high school. We were always trying to do it, but we couldn't find a partner where we could afford to provide what we wanted to. And you helped us find health partners of Western Ohio. Mm-hmm. So share with us what takes place in that health clinic that's in the high school.
So that health clinic can see anything from a minor ache and pain. They can do ear checks, they can do physicals, they can give immunization, people who just aren't feeling well. They can help with mental health resources if you need them. They also can help with just resources within the community. If we have a family who maybe needs help finding a food resource, they have those services. It can act as a primary care physician if someone doesn't have one, but then it can also function kind of urgent care.
What job titles are on their staff in that health clinic?
In the health clinic, they have a receptionist, they have a medical assistant, they have slash nurse, they have a nurse practitioner, and then they have a mental health social worker.
Good. Who can go to that health clinic?
So anybody in the Springfield community. So any of our students, their families, our staff can go. Anybody in the area who just needs a place that they can get medical treatment.
Excellent. And I've gone twice, and it turned out very well. They're a wonderful staff, and they do a great job. So we're actually in this room here at 6900 Hall Street, and this is something you helped create too, Liz. This is the clothing closet that has been amassed over a couple of years. When you look at the clothes and the shoes and the health products that are in here to assist, share with our audience who has access to this.
So we kind of like this as we just had a need. Everybody had a little bit everywhere. So we had some items stored in all different locations, and it wasn't getting used appropriately because we had things that weren't in the right sizes and buildings. So we brought everything to one location and really did it into what it is today. And we have families that contact us directly and say, hey, I'm in need of such and such item for my student. We then also stock nurses, counselors. So if we have students who have accidents throughout the day, spilled milk, just a rip in a pant, so that way they don't have to leave school. They're able to stay in school with clothing that's appropriate and fits and is clean.
Yeah. And I know that we've talked when we've had some homes or apartment complexes that have had fire or water damage.
Yeah.
You want them to come here and get some items that they need to get through until insurance kicks in or can go purchase their own items. So that's been a great partnership too.
Yeah.
Any questions I didn't ask about your department that you'd like to share, Liz?
I think one of the biggest things to tell is, and I looked up the statistics for this year, is that we as nurses in the district, so between the 6 nurses in the district, we've seen 35,000 student visits this school year so far.
Wow. And to what degree are those?
So that's everything from a scraped knee, getting medication for a student daily, a stomach ache, just needing a Band-Aid, maybe needing a snack, to something more serious like our diabetic, students with asthma, any of our other chronic conditions. So hearing and vision screenings that are required by the state.
35,000 is a lot in one school year with
It
a
is.
whole month to go.
Correct.
So thank you for what you do to guide that area and to take care of our kids and our staff.
Thank you.
Because I know that you assist them too. And thanks for bringing that health to our district. Thank you for tuning again to another edition of Inside Springfield. We'll be back soon with another director.